Today I'm going to show you how to set up and use an electrical surgical unit, also known as an ESU, also known as a Bovie. First thing you're going to want to do is consider all safety precautions. You want to make sure there's no metal or jewelry near the patient or near any of the staff because it can conduct electricity. When using a Bovie, you're going to make sure that the patient has what is called a grounding pad. It's going to be placed directly, it's going to be close to the surgical site, but not directly over it. And this way, electricity passes through the patient and into the grounding pad. You're also going to have what is called a scratch pad, and it's used to collect pressure, which is buildup in tissue that is on the Bovie. After that, you're going to make sure that there are no frayed wires or damage to the power source. If the power source is damaged, it's going to have to be replaced, and you're going to have to call Biomed. If you have any frayed wires or anything, then you can't have that. So you're going to have to replace those wires, or get a new Bovie tip or a new grounding pad. After all safety precautions are considered, you can start setting up your equipment. So the first thing you're going to have is your ESU, also known as a Bovie. It has a pencil and an electrode. This is the part where electricity passes and is used to cut and coagulate during surgery. This is a monopolar instrument. That means that electricity passes from the power source into the unit, through the patient, and to the grounding pad. Another type of tip that we use is called a bipolar. And the difference between this and a monopolar is electricity travels from the power source to one side of the unit through tissue and back to the other side of the unit, and then back to the power source. And then the bipolar would be used on smaller cases, like cases where there isn't going to be a whole lot of blood or fluid. After that, you're going to get your suction tips together. First one is called the Young Power suction tip. It is the most common suction tip that is used for more superficial cases inside the chest or in the abdomen. The next one you might use for deeper abdominal cases or cases that have a lot of blood or fluid is called the pool suction tip. And then lastly, for smaller, more delicate cases like neuro or vascular, you're going to use what is called a Fraser suction tip. Suction tips are used for suctioning blood or pulling smoke that is used while cutting tissue, cauterizing